topics and opinions expressed in the following show are solely those of the host and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert Show on W4CY Radio and Talk4 TV, where we bring you educational information from experts on such topics as legal, health, financial, and home improvement. Now sit back and listen to our experts in community association law, estate planning law, tax relief, Medicare, public insurance adjusters, neuropathy treatment, business brokers, and personal injury law, along with many other topics. Now here's your host for the last 17 years, Steve O.
Tennessee, welcome to another Ask the Expert show where we bring you the top experts in the field of legal, health, financial, and home improvement. I am so excited about the show this morning. I just got through having cataract surgery, and I'm going to tell you something. I was a procrastinator. I would drive down the street at night and I'd see a star that all of a sudden was twinkling, or a street light, and I knew I had a problem. Because of this show, I got to tell you, it got me motivated to get my cataracts done. And we're going to be talking about cataracts today. We are so lucky. We have got the top ophthalmologist, I would say, in the country, out of Tennessee, though, Wang Vision Institute. We have our famous Dr. G. Good morning, Dr. G.
Good morning. How are you guys doing?
We are so, I got to tell you, without your show, who knows how much longer I would have waited to have my cataracts done. And for those of you who are afraid of it, we're going to get rid of those myths today. But hey, Dr. G, tell people about Wang Vision Institute, first of all.
Yeah, 100%. So we are a premier cataract and refractive surgery practice in Nashville, Tennessee. So we've been in practice for about 20 years. We do 8 different surgeries to help patients out of glasses. Really, it just depends on your goals, your age, your prescription. But kind of the bread and butter of what we do is cataracts, and especially within those cataracts, helping patients achieve their goals of not wearing glasses.
I got to tell you, I asked my ophthalmologist here in Florida, I said, do you do SMILE? And he was like, you know what SMILE is? I learned from your show. He said, no, we don't do SMILE. And I was like, God, that's why Wang Vision is so ahead of their time, because you do it all.
We do a lot of stuff.
So we're going to talk about cataracts today. And I got to tell you, Dr. G, I was blown away how easy the entire, because you got to start doing the drops before and the drops after. This was so easy. I cannot even begin to tell people how easy this was.
Yes, 100%. I mean, one of the biggest things I hear about cataract surgery is patients tell me afterwards, Doc, I wish I had done this sooner. Doc,
yes.
Yeah,
exactly.
After surgery, I've had patients kind of repaint their whole house. People slowly lose the detail, the quality, and then once they kind of regain it back, it's almost like they're seeing everything through high def, right? I mean, for them, the colors are back, the brightness is back. So it's really cool even for me to see that side of the reaction of things where patients are like, Doc, thanks.
And it doesn't take long. That was something that blew me away.
That's right. So the surgery itself, each eye can take about 15, 20 minutes. So very smooth. Here in Tennessee, we do one eye at a time, but some states allow for even both eyes on the same day.
Yeah, that's how it is here in Florida also, is one eye at a time. So, what exactly is a cataract and how does it affect the vision?
Yeah, so just like a camera has a lens, our eyeballs have a lens inside of the eye. Now, that lens does two things as we age. One, we get into our 40s, 50s, that lens gets very stiff. That's when we lose the ability to read. That's when we start needing bifocals or cheaters or progressive lenses. Over time, that same stiff lens starts to become gray, starts to become cloudy, starts to become opaque, kind of like our hair. That's what we call a cataract. So a cataract is the natural graying of the lens inside of our eye. Now, we do cataract surgery once you start to become symptomatic. So once that lens becomes gray enough, it starts to cause more glare, more halos, starts to cause more difficulty driving in night, starts to cause more scattering in low light conditions, dim light conditions. Overall, decrease in quality, harder to read. You're going to keep changing your glasses, it's not working. So these are all signs and symptoms of the cataract ready for surgery.
I got to tell you, I think everybody is different, first of all. I had LASIK done about, 15, 16 years ago. Oh my God, it changed my life so much when it came to
Yes.
reading. And the doctor
Yes.
said it's going to last about 10 years. Well, it's been, like I said, 15, 16 years ago, and I can still read without reading glasses. So that's the first thing. But when I had the surgery, the doctor said, you're going to lose what you got from LASIK. But I got to tell you, I still don't need glasses to read.
Yeah, that's really good. That's really good. So everyone just kind of heals a little bit different. So LASIK and SMILE, both of these are ways to reshape the cornea. So when we're younger, the lens inside of our eye, it's not stiff yet. We can still read at all focal lengths. So that way we can use LASIK to reshape the cornea so that you don't need to wear glasses. SMILE is just a small incision way of doing that. So there's no flap, no complications, a lot less dry eye. So probably what your doctor was referring to you is the way you ended up healing after your LASIK. You probably were just naturally still a little nearsighted. So not nearly as what you were prior to LASIK, but because you were still a little nearsighted, you retained that reading ability. So when you do cataract surgeries, there's different options of lenses that you can choose from. So depending on what he was talking to you about, that's why he was talking to you about that you may lose that reading. Now everyone heals a little bit different, so it sounds like you had a great outcome, great surgeon. So just naturally, you're just going to keep both.
So, do you ever see younger people needing cataract surgery?
Yes, some people can get cataract surgery. So there's one condition called congenital cataracts. So some people are actually even born with a cloudy lens. And if in those cases, it's pediatric ophthalmologists that will do the surgery. Now, sometimes patients can have congenital cataracts but not need surgery, meaning it's not gray enough, it's not causing symptoms enough. But by the time they're 20, now for them, it looks like a 60-year-old cataract because they were born with this cataract. So I've done cataract surgeries in patients that were in their 20s. People that
Wow.
have a people that have a history of trauma, people that have a history of diabetes, people that have a history of steroids, from either oral steroids, injectable steroids, they can develop cataracts sooner. So a lot of people can develop cataracts for different reasons, but definitely even younger people can develop cataracts.
Well, we are getting inundated uh, from TikTok and YouTube, people wanting to know how do you know that you need cataract correction done?
Yeah, very good question. I get this question asked a lot of the times. So cataracts, the way that we look at them and objectively they look to us, they're graded on a scale of 1 to 4. So 4 being the most gray, most cloudy, very big cataracts. Typically, I say the ideal stage to operate is kind of around that 2+ stage. If you wait till it gets to that 3 or 4, it makes the surgery harder. And why I say the 2+ stage is because that's the stage at which most patients have symptoms. So typically, it's time to do cataract surgery once you're having symptoms. So if you're having difficulty driving in the night, if you're having more glare and halos, you keep changing your glasses, it's not helping. You're putting in eye drops, it's not helping. What you used to be able to do pretty easily now is becoming more harder. You need more light to see stuff. These are all signs and symptoms of cataracts.
What
So at
about,
that point,
go ahead.
yeah, so at that point, I mean, at that point, it's worth doing surgery to kind of have the benefits of the surgery last longer. Versus the symptoms are just going to get worse and worse, and then it makes the surgery harder.
So when I originally had LASIK, he said it lasts for about 10 years. When you do cataract surgery, how long does that last for?
Yeah, it's lifelong. So cataract
Nice.
surgery is lifelong. So when we do cataract surgery, we go in there, we remove that cloudy lens and replace a whole new lens in there. That new lens that we put in there has a prescription unique to your eye. So that cataract, that cloudy lens never comes back. Now, eventually, the new lens that we put in develops a little bit of scar tissue. It happens in everybody. Whenever that happens, we do a laser in the office. It's covered by insurance. It takes about 1 to 2 minutes. So you don't have to go back to the surgery center. You don't need anesthesia again. It's a procedure just done in the office to kind of clean up that lens. But besides that, really, the cataracts never come back.
When does that show up, Dr. G, after surgery?
So the lens over time just slowly becomes cloudy. Some patients need it removed sooner. Some patients removed need it removed later. So it's kind of like cataracts in the sense that we only remove it when you're symptomatic. So I have some patients kind of at the 3 month mark. They've already have a lot of scar tissue and they're already symptomatic. But similarly, I have a lot of patients that it's been 2 years, 4 years, 5 years. They have the scar tissue, but they're not bothered by it. So we just kind of keep an eye on it with their annual eye exams when we screen for glaucoma, macular degeneration, things like that. Symptoms of the scar tissue would be like you'd almost feel like the cataract is coming back. You'd have an increase in glaring halos again. You'd feel like the vision was not as sharp as it was right after surgery.
What about lifestyle factors like sun exposure or smoking or diabetes? You mentioned diabetes before. Do those increase the risk of cataracts?
Yeah, so cataracts is an aging process. Just like our hair slowly turns gray, so does the natural lens. Now, there are certain factors that can accelerate the growth of cataracts. That includes, prolonged UV exposure. So recommending wearing sunglasses whenever you're outside is a good idea. Smoking can increase that risk of acceleration, diabetes, high blood pressure, certain medications. But even if someone doesn't have any of these conditions, just as a natural aging process, they're going to develop cataracts.
So I want to kind of walk people through this. So they come into your office to be diagnosed first. Um, what is the process? I mean, to me, they kept taking me to different stations and looking in my eyes, but it was so easy though.
Yes, yes. One of the nice things about ophthalmology practices is we have all the diagnostic equipment in-house. Unlike if you go see a primary care provider, they might have to send you out to get a scan of the heart, a scan of the leg, and things like that. But here, we get all the scans in-house, so you're not referred anywhere. So all the scans we use for our preoperative data. So these are scans to determine for us what is the size of your eye? What kind of retina history, glaucoma history do you have? How dry are your eyes? And then it also tells us what kind of lens to order for you, what power of lens to order for you. So all those machines you went through are likely what we call preoperative diagnostic equipment. So typically we bring patients in for a cataract eval. We'll get all the testing. Then the provider will go in, we'll talk to the patient, we'll examine them. Then we kind of go over all the surgical risks, and then we go over lens options for them. So, what kind of lens would they want? What are their goals? What are their hobbies? And then after that, we kind of get you on the books. So typically, we have a lot of patients kind of actually fly into our practice. So we are able to kind of work patients in within about a month. But if someone's flying in, we'll actually save you a surgery spot that week. So say you
Mm,
come in on a Monday, we'll save you a surgery spot on that Tuesday or Thursday in anticipation that you would be a good candidate and you're ready to proceed. Typically, we say for about 10 days after the surgery, no heavy lifting, bending, or straining because we close all the wounds without a stitch. Post op, we typically see you 1 day, about 1 to 2 weeks, in about a month. But again, if you're flying from out of town after that 1 day post op, if you have somebody locally you trust, it's totally fine for them to follow you up.
I was surprised at how short the surgery was. I was also, I say I was awake. Maybe I wasn't. I know there, but yeah, I didn't feel a thing.
Yes, yes. So it's a same day surgery, performed at surgery centers. We do have anesthesia there, but you're not fully asleep. So you're right. I mean, you weren't asleep. It's more kind of twilight, meaning you're a little sedated,
Mhm.
but you're not asleep, but you're comfortable. So you're not nervous. Everything's kind of relaxed. But if I need you to follow instructions, hey, look right, look left, look up, you're able to.
Right.
Yeah.
And I was surprised how short the recovery was, Dr. G.
Yes, yes, yes. Here at our practice, we use a laser for all of our cataract surgeries. So that even helps the recovery and that first day healing a lot more, So there's a lot less swelling, reduces human error. So a lot of patients, just like you, the next day, they're like, Doc, I can't believe I'm already seeing this less than 24 hours out.
Exactly. Uh, do you ever, can cataracts ever be treated with glasses or medications, or is surgery the only option?
No, no. I mean, so cataracts, again, you're looking through a cloudy lens in the eye. So even if you put glasses in front of the eye, you're still looking through a cloudy lens inside of your eye. So glasses can help a little bit, but still you're looking through that cloudy lens, so it's not going to really do much. Same thing with drops. So there are some drops that are marketed that they get cataracts to go away, but none of that is um, proven to be true. So I wouldn't try to do any drops for cataracts or anything like that.
I am so glad you said that because, the internet picks up whatever we talk about. And since my
Yes.
cataract surgery, I am getting so many ads, people saying, you don't need the surgery. You can use
Yeah.
our drops. I mean, and I know it can't be true. And I'm so glad you said that.
Yes. Yes. That's a big one we hear at our practice as well. They're like, Doc, does this work? Does this work? And honestly, I don't even know what these drops are. Patients are like telling me about these, and I'm like, I've never heard of this. No, this is not going to help do that. I mean, this is not going to get rid of your cataracts. There is no drops that can reverse the graying of your lens.
Wow. So when is the perfect time to consider the surgery?
Yeah, the ideal time is, there's not an age. A lot of patients think, Doc, is there a specific age I should get cataracts done? Do I need to be a certain time? Do they need to be ripe enough? No, all of these are not, there is no age, there is no time it has to be ripe enough. Really, it's just when it's starting to become symptomatic, when it's affecting your daily quality of life, when you're losing that independence, when you're kind of struggling with the glares, the halos, the night driving.
We just had a mother contact us. I am really enjoying your show. I am going to have my mother come in and see you. But do you ever get children with cataract problems?
Yeah, 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 we do. So kind of like those congenital cases. So if they were born with congenital cataracts, but they never had them removed as a child, now by the time they're 15, 20, it's progressed because the cataract's life age has already been 15, 20 years. So when we're looking at it, it looks like an adult cataract even though it's in a child. um, Sometimes if they've had a history of trauma. But if they're really young, we'll refer them to a pediatric ophthalmologist. But if they're kind of in their late teens or 20s, then we'll do the surgery at our practice ourselves.
Well, I got to tell you, Dr. G, I am so amazed that before, I think I was farsighted, I believe. And I was so amazed that I went to the movies the other night, and I normally have to put my glasses on, and I didn't need my glasses. In fact, I don't even, I just went in for, I think, my final, I guess, meeting with the doctor to look at, is everything okay? But I said, do I still need prescription glasses? And he said, are you seeing fine? I said, I can't, yes. And exactly. I don't even need prescription glasses anymore.
Yes, 100%, 100%.
So I'm hoping from the show that people will not procrastinate. Call up Wang Vision Institute. They've got such great doctors. Dr. G, I thank you so much
for thank you for having us. We always
and
anytime.
I want to tell you this because you always want. I'm just looking at TikTok alone. You've got over 5,000 people liking the show. That's pretty amazing,
wow.
Dr. G.
That is really nice. Really nice.
Tell people how they can reach your office.
Yeah, so you can always contact our practice at www.wangvisioninstitute.com. My email is drguduru@wangvisioninstitute.com. Our number is 615-321-8881. So any of these work. So in our website, we have a place where you can directly kind of submit any request you want, any question you have, and somebody will always reach out to you.
Dr. G, you're a superstar. People love you.
Awesome. Thank you so much.
We'll see you next month.
Yes.
Thank you. That's Wang Vision Institute. They're in Nashville, Tennessee. That was Dr. G. Hey, folks, seriously, don't let your cataracts go. Get it done now. It's such an easy service. That's going to do it for us today. We'll be back again with you tomorrow with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.